Well, hi, everybody. It's the most wonderful time of the year. And by that, I mean it's Medicare open enrollment season. That's the time between mid-October and early December when people 65 and older can change their Medicare coverage for the year ahead. And today we have an expert to help you or your loved ones make smart choices. He's Phil Moeller, author of the new book, Get What's Yours from Medicare. Hi, Phil. Thanks so much for joining us.
Thanks for having me. It's a pleasure to be here.
Great. Maybe you can start by reminding us briefly what we can do during Medicare open enrollment, what Medicare open enrollment is all
Sure.
about.
Um, Medicare open enrollment is a terrific do-over opportunity for Medicare every year. And the key thing to remember is you can't be denied a change in coverage. If you elect a different kind of coverage for 2025, Medicare has to honor your results, and all the insurance companies have to honor your results. They can't deny you coverage based on pre-existing conditions. They can't raise your rates. So it's a terrific opportunity to take a look at your coverage. Having said that, the options are straightforward but complicated in execution. So the straightforward options are if you have traditional Medicare, which usually is parts A and B of Medicare, plus a Part D drug plan, and often a Medigap supplement plan that closes the holes in things that Medicare covers but does not fully pay for. That's sort of the traditional package for regular Medicare. If you have that, you can also switch to Medicare Advantage. These are private insurance plans. They have to cover everything that regular Medicare covers, but they also have the ability to offer supplemental benefits like hearing, vision, and dental coverage for routine needs that traditional Medicare is not by law allowed to cover. These supplemental benefits have made Medicare Advantage plans really popular. So during open enrollment, if you have a Medicare Advantage plan, you can switch to a different Medicare Advantage plan. If you have a Medicare Advantage plan with Part D drug coverage, which most people do, you can switch to another Part D embedded plan. Or you can switch to traditional Medicare. There's an asterisk here because if you switch back to traditional Medicare, your ability to get a Medigap supplement plan on favorable terms could be restricted because guaranteed access to Medigap only lasts for the first 6 months after you're eligible for Medicare. During that period, again, you can't be denied coverage, you get good rates, you get advantage access. The insurers, if they sell a particular Medigap plan, they have to sell it to you. They can't say go away. Those rules change after that 6 month period. So you have to be careful about this. And so my advice is for people, if you're thinking of going back to traditional Medicare for Medicare Advantage, look at what's going to happen to your Medigap plans before you make that decision. Having said, to be on the lookout for restrictions, insurance companies are in business to sell insurance. They're not in business to tell you to go away. So I think the odds are pretty good you're going to get a Medigap plan, but you might have to pay a little bit more for it. But those are things you should find out ahead of time. And the good news is that while open enrollment begins on October 15th, it lasts all the way to December 7th. What does that mean? It means if you elect your changes on December 7th, they're still going to take effect next January 1. So don't rush to judgment. Give yourself some time. Wait for some of the policy experts to weigh in with assessments of next year's coverage and take advantage of their expertise. Some of those studies don't come out until November. So I realize people get antsy about this topic. So this is my professional advice. Take a chill.
Yeah.
Just don't feel like you have to do stuff yesterday. Give
Now,
yourself some time.
uh, thanks for that introduction to explain sort of the big picture about open enrollment. But I've also been hearing that this particular Medicare open enrollment season could be trickier for people than usual. I wonder what you think and why do some people think that?
I think any well-informed person should think that based on what's been going on. And I need to drill down on this a little deeper. Um, the Inflation Reduction Act in 2022 triggered a lot of far-reaching changes in Medicare. Um, The one I want to talk to first has to do with Part D drug plans. Part D drug plans have been just nuts for years. They have all these different phases. Nobody understands the phases. I don't understand the phases, and I do this for a living. Um, the phases are going away, which is great. Now, Medicare doesn't tend to do things right off lickety split, so it takes several years for these changes to take effect. Last year, for example, Medicare got rid of the so-called catastrophic phase of Part D plans. Catastrophic coverage in Medicare is for people who take really expensive drugs. Once you reach that phase, traditionally, you only paid 5% of the cost of a drug. But as every good mathematician knows, 5% of a big number is a big number. And so, even with that catastrophic quote protection, some people got hit with really high out of pocket expenses. Last year, the catastrophic zone ended, so your drug cost stopped once you hit the catastrophic zone. It turned out to be about $3,300 a year. That's how it worked out. Next year, that zone disappears, and you have a flat $2,000 out-of-pocket cap on what you pay for drugs. This is a great deal. And for people like me, I take an expensive, biological drug, and I hit $2,000 in January every
Yeah.
year. So
Yeah.
I'm going to be done with my drug expenses, early on. But there are implications for this, and your listeners need to know what they are. Only about 6-7% roughly of people on Part D plans have expensive drugs. So those 6 or 7%, they get a great deal next year. But the other 93, 94%, what's going to happen to them? Well, the changes in the Inflation Reduction Act not only cap drug prices, but they change who pays for all those amounts. And so the so-called inflation savings in the Inflation Reduction Act are because Medicare is offloading billions of dollars that it has historically paid for drugs onto the insurers and the drug manufacturers. So, what are they going to do? Oh, woe is us. We're just going to pay the money. No, they're going to look to get it back wherever they can. Duh, big surprise, right? That's what
Hmm.
these people do for a living, and they're really good at it.
Yeah.
So, they're going to be seeking not higher deductibles because those are already close to a $600 max, and more plans are just at the max. But they're going to be seeking higher copays. They're going to be moving drugs from a lower cost tier of their plan into a higher cost tier. They're going to be doing whatever they can. And in some cases, they're simply going to stop covering drugs entirely. Certain classes of drugs that are really expensive might not be covered next year. That was the case with one of my drugs that my plan said, oh, we're not going to cover this.
Hmm.
Uh, so that's homework you need to do ahead of time. The worst thing in the world is to have this drug plan and then find out, oops, my drug isn't covered. Um, but the other thing to keep in mind is that the changes in this law also affect the relative appeal of Part D standalone plans for traditional Medicare and Part D plans that are embedded in Medicare Advantage. Medicare Advantage, the way they're paid by the government, they get some subsidy payments that they can use to help offset other costs. That's how they pay for these supplemental dental and health and vision benefits. But these plans also use those benefits to subsidize their Part D coverage. A lot of Medicare Advantage plans, therefore, have zero premium Part D plans, and they're going to continue to have that next year. So, zero premium plans are like the bright, shiny ornament in the store that makes you buy the product, but they're not necessarily a reflection of the lower cost. But
Yeah.
guess what?
Makes
Consumers love their zero
sense.
premium Medicare Advantage
Yeah.
Part D plans. I expect that this is going to make Medicare Advantage plans even more attractive to people next year.
I,
So this
I think,
triggers the next thing that you want to know
well,
about, right?
I think we should stop for a second and let Terry talk about Medicare Advantage plans. She is not a fan, right, Terry?
I have been writing, I just went back over my columns
for the last 4 or 5 years. When I first started noticing this, and then I had stories from people who have Advantage and told horror stories of being in the hospital, the doctor ordered tests or MRIs or whatever it would be, and they couldn't get it approved. And the doctor was so annoyed, they had to go back 4 times, and maybe they finally got it approved. So I've been writing columns for years that if you can afford, and I'm tossing this my best overhead drive into your court, Phil. If you can afford traditional Medicare and a supplement and a Part D drug plan, which, as you just pointed out, every year you have to go to medicare.gov into your My Medicare account and say, these are my drugs, or I got this new drug this year, which plan works, separate Part D. If you can afford those, it is a much better way to go in case you're seriously ill, because the way Advantage plans make money is that they get a certain amount from the government based on various things for all the, and more than half of Americans have them. And the way they profit is they deny or ration service. Now, as we were going on the air, a news report came. 25% of Humana's member plans have signed up for plans where their star ratings, I want to ask you about that because there are ratings, had dropped dramatically. Humana's stock has been cut in half since January, when they reported disappointing profits and said, because we had higher costs for Medicare Advantage, we had to lay out more money for stuff. What do you think they're going to do? Stop approving. And now 90% of corporate plans are in this lower 3.5-star rating. And you're going to, that, which is really means that it's great if you don't get sick. You pay next to nothing and you get your drugs. But now, God forbid, whatever it is, breast cancer, hip replacement, only the doctors in the plan, only the tests they approve. And you wrote in your book, Get What's Yours from Medicare, about the Kaiser Family Foundation study that said that they had been denying claims, denying requests for service right and left. So there's my rant. Tell me, after knowing all that, knowing that they're in business to make money, they've been losing money, their stocks are down, they're going into a year with lower ratings for service, and they're probably going to have to deny more services to people in the plans, and doctors are going to drop out because they hate it. How could you tell anybody to be in Medicare Advantage if they could afford the other original?
Well, I'm certainly not going to sit here and defend Medicare Advantage to you. However, let me just point out a couple of things. First of all, your first point about traditional Medicare, I'm with you. I mean, people who have the financial ability to buy the best protection should get traditional Medicare. They pay their Part B premium. Part A is free for most people who qualify for Social Security. So they pay that premium, which has been what, $175 a month, something like that. It's going to go up next year, big surprise. They pay that, they pay their Part D plan, and they get a Medigap supplement plan. So this is what I do. However, I am a heavy medical user. Surprise, I'm in Medicare. And because of that, I've calculated that my out-of-pocket costs are the cheapest with this package. I have a letter G Medigap plan, which is the best plan, most comprehensive plan that new enrollees in Medicare can get. Older enrollees get more comprehensive coverage, but if you're new to the program, you can't get that. So I'm happy to go details. I'm 78 years young. I pay about $2,600 a year for my Medigap. That's what I pay now. It was less, when I started. So I pay $2,600 a year. What do I pay? What's 12 times 175? Say it's 2,000, whatever, and change. So what does that have me up to? Like $5,200 a year, a little bit more. And then I have my Part D plan, which has monthly premiums. I get the cheapest premium Part D plan I can because I'm going to be $2,000 out of pocket anyway. So why should I pay it up front for a premium? I'm going to get it back.
Right.
So my Part D premium is $5 a month. So, You don't even have to change my rounding numbers. So say I pay $5,500 a year. My wife has a similar package. Together, our medical bills last year were $500,000.
But
Oh,
not you paid, that
I had a
Medicare,
new shoulder.
but
A new
Medicare,
shoulder alone is 300 grand.
yeah, but Medicare
That's what I
paid.
was billed.
Okay.
My wife was in the hospital. Ka-ching, ka-ching, ka-ching. Our out of pocket for that $500,000 was zero.
Okay.
The letter G plan covered everything. If Medicare covers it, Medigap will pay the gap in the claim, no questions asked. Occasionally, as we know, healthcare providers try to sneak in things that aren't covered by Medicare, and that's sort of on us to be diligent. But the bottom line is, I'm pretty diligent guy, and my wife makes me look like an amateur. So we didn't pay anything for that. So the out-of-pocket maximum for most Medicare Advantage plans is like 8,000, 9,000. If you go on a network, which is, God forbid, it's going to be much more than that. So the allegedly cheaper Medicare Advantage plan is more expensive for me. Plus, I have in traditional Medicare, as you know, you can use any healthcare provider in the country. You rarely need prior approval. And so for me, it was like a no-brainer. However, big however, healthcare is bankrupting us as a nation. We pay almost twice as much per capita for healthcare as any other country. So imagine if we had an extra 6, 7, 8% of GDP, billions and billions and billions of dollars that we could spend on climate change, social programs, infrastructure. Can you imagine how much more vigorous and healthy our economy would be? And so basically, healthcare has become a tapeworm that's eating us from the inside.
mhm.
Medicare Advantage, much as we don't like it, is a managed care program that this nation has to figure out how to make work for everybody.
Wow.
Traditional Medicare is a fee-for-service program that doesn't have any guardrails on usage. So when I had my shoulder done, I said, well, I want to make sure I get the best surgeon I can find. I had 3 consults. I went to 3 different good local surgeons that were highly recommended. They all took pictures. They all took, scans. They all, tested me for whatever. And Medicare paid for that 3 times. So in my book, I said, well, as a consumer, I feel pretty good because as taxpayers, I'm a little sheepish here because this is not good for our society. So how do we put bigger guardrails on healthcare costs? Well, on paper, that's what Medicare Advantage is supposed to do. However, guess what? These are for-profit companies, and what's good for the
Right.
nation
That's
and
right.
what's good for the bottom line often don't mix.
Yeah.
Having said that, once again, Medicare, slow to take action, is tightening the screws on these plans. That's why the star ratings went down, because they're starting to say, you're not getting your bump. Star ratings are important for consumers, but they also generate bonus payments for the Medicare Advantage plans. They are
Mm.
a big deal for those plans. The lower ratings are costing them big time money next year and in the years after. In addition to that, Medicare has said, clean
Roy,
up. Go
we
ahead.
should say to people that if you go to medicare.gov, where you can search your supplement plans, supplements all the same, G is all the same, but the price may be different and the service may be different. So you check if you're looking for a supplement. If you're looking for an advantage plan, the prices are different. Some have 0 upfront premiums. Some have small upfront premiums. They all have the same maximum out of pocket for the year. If you get sick, you'll pay that much, but no more. But they also have these ratings. Explain who gives those and how those are made, because you want to look at that, because one company, Humana or United Healthcare, could have multiple plans, each with different star ratings.
Sure.
Please, you're the expert, explain that part.
Um, well, again, mere mortals really can't understand this, and I'm a mere mortal. However, I do know that Medicare purports to base these quality ratings on gazillions of indicators of quality. What's quality? It is clinical results are quality. Um, Provider evaluations are quality. Consumer evaluations feed into some quality. Those are sort of dubious from my standpoint. But the bottom line is, I think the ratings fairly reflect a broad range of indicators that are associated with what you and I would consider high quality healthcare. However, plans have gamed the rating system because they want these high ratings. They know what the variables are. And so Medicare has basically said, we're tired of being gamed. So they have tightened the screws on these quality ratings and they've reduced them substantially. So that costs the plans money. But the question is, what does it mean for consumers? Well, I'm sorry, but if there is a 4.5 star rating that Medicare downgraded to 3 from year to year, I doubt that that's reflective of fundamental changes in the plan. It's reflective of Medicare deciding to tighten the screws. So I'm a little bit less concerned than you are, Terry, with doing business with a 3 star, 3.5 star
Uh,
plan. I think most consumers are going to be okay with
hmm.
those plans. Um, and I think that when you use your plan finder tool, which is the tool you referred to,
At
look at
medicare.gov.
yeah,
At medicare.gov.
certainly look at the star ratings, but look
Mhm.
at dig down and look at the details of the
Mhm.
plan. The
Yeah.
most important aspect of Medicare Advantage are there's only a handful.
Mhm.
Are my drugs covered? Big deal. Are my healthcare providers people I like, or at least I can stomach in terms of dealing with them. So I've talked to, my book tends to emphasize not the horror stories because we've all heard those, but the stories about what happens when coverage works. And my statement, which I think is pretty sound, is how do you know what good healthcare coverage looks like if you never see any?
Yeah.
So I try to find examples of things that work. So I found this woman in Florida. Her doctors are all, Cleveland Clinic doctors. She loves her doctors. She loves not paying for Medicare Advantage. She loves the supplemental benefits. Um, for her, I really can't say that Medicare Advantage is a bad deal.
Mm.
Um,
I want to jump in just for a second. And first of all, I feel like we have like two of the country's foremost experts right here in this room, and there's so much to cover. And I'm going to ask, like, I'm going to get a kind of a dumb question in here that's more simplistic because this is all so valuable. And thank you, Phil, for all the good work that you're doing with this. You're helping so many people. But I have two questions for you. One, is there ever a time, getting away from the advantage plans for a second, but is there ever a time when someone should consider skipping Part D coverage altogether?
Oh,
Because,
um, Actually, yes. It really all comes down to money. So, and I'll use an example of a good friend of mine who knows who he is, but will remain anonymous here. Um, this person was very successful in life, retired at the age of 52, um, and basically self-funded all his drugs when he joined Medicare. Didn't take a lot of drugs, um, and looked at it as a cost exercise. So there's a late enrollment penalty for Part D. It equals it's none of these things are clear. It's like 1% a month for each month you're late, not applied to what you pay for Part D, but applied to a so-called national premium calculation. Blah 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 blah. And so it turns out that that's something on the order of 40 cents a month. That's your 1%, but it's cumulative. So in my friend's case, and they're lifetime penalties. As long as you have Part D, you're going to pay those penalties. So in his case, he has 10 years of penalties. So what's that? That's 120%. His Part D premium will be jacked up 120% a month for the rest of his life. Well, he can afford it. So now that you have this $2,000 lifetime cap on
Yeah.
these drug expenses, he knows exactly what his exposure is going to be. And for him, it was worth it to not get the Part D. He didn't have a lot of drug needs. He didn't have any paperwork. He didn't have any of that stuff. And so his life was somewhat easier. It's a cost benefit calculation you need to face.
Mm.
For most people, however, I think it's stupid not to get Part D.
The thing is, you take out Part B when you get on Medicare, when all you take is Tylenol or Aleve. But I guarantee you within 10 or 15 years, there's going to be someone's going to yell at you about a statin or a blood pressure or something that you're going to take every single day, wondering why that is, but that's neither here nor there. And so it may look great at the beginning, but it doesn't look so great if down the road. We don't know what
sense.
is. So
Yeah,
you
that
don't want
makes sense.
offsides. Even if you take Tylenol, sign up for the least expensive Part B plan. You have no drugs. That's okay. It's just a cheap throwaway for when you might have them.
Okay.
I think
Phil, my follow-on question to that really
Yeah.
quickly, because I want to be able to get it, move things forward here, not hold things up. But my follow-on to that is, we know that, Terry recommends that you do look at your plans every single year because they can change. My question is, can they change the formulas like during the middle of the year? While you're, and how does that work?
Well, the broad answer is no, they're not supposed to do that. The practical answer is S dash 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 happens. And so plans do make changes. There are drugs that come onto the market, drugs that the FDA changes their minds about. And so your drug formulary can change during the year. In terms of the other thing that can happen is you're in an MA plan, your providers can change. Look at Stewart Hospital, this huge hospital chain that went bankrupt. I can't believe that that their participation is not affected by that. The other thing to keep in mind is that because of these headwind pressures on these Medicare Advantage plans, they're pulling out of entire geographic markets in 2025. That's another reason for people to pay careful attention. Yes, quote, they're supposed to tell you this. They do these annual notice of change statements that come out in the fall. They are among the least read documents in American
they get tossed.
society.
Yeah, that and credit card payments.
Right. So I do think there are going to be some people who've got Part D plans this year for prescription drugs that are going to be told that plan is not available at all next year. And others who are going to be told, yes, we offer that plan, but here's what's changing. And the changes could be the things you were just talking about. The cost could go up. Your medications might not be offered, covered anymore, or they might be covered, but much more expensive. And that leads me to something else that's new for 2025, and that's what's called the Medicare Prescription Payment Plan, sometimes called M3P, I think. I
That's
wonder
what
if you
I
could
call
talk
my book, yeah.
a little bit about what this is, who should think about doing it, and what they should know about it.
This is a well-intentioned pro-consumer plan that Medicare has implemented. It allows you to spread the costs of your prescription drugs over the course of a year. So, for example, my $2,000 out-of-pocket maximum that I hit in January, I don't have to pay that all at once. I can spread it into 12 equal payments and pay it over the course of the year. The wrinkle here is that the insurance company is supposed to handle that, not my pharmacist. I really empathize for all the pharmacists out there who are deer in the headlights when it comes to this new program. I talk to my pharmacists I do my drugs at CVS, so there's, several people I chat with. None of them even heard of this.
Right.
Um,
And it's starting January 1st.
It starts January 1st. But for me, for example, yes, I can afford a $2,000 hit, but Terry would slap me on the wrist for not taking advantage of free money. So rather than laying out the $2,000, I can use my drugs, but I can only have to pay out 1/12 of that every year. And basically, my insurance company is financing the
Yeah, there
$2,000.
you go.
Yep,
Yeah,
just
Why
a,
wouldn't I do that?
that's right.
just a couple things I want to mention about that. I just wrote an article for fortune.com about the prescription payment plan. And a few things I heard is one, if you sign up for it, which people recommend if you're going to get it, sign up for it during open enrollment so it starts January 1st. Don't start signing up for it like the middle or late next year. But if you sign up for it, what's going to happen is you go to the drugstore, you get your prescription, but you're not going to pay for the prescription then. They'll give you the prescription. What you're going to get is a bill in the mail or maybe online at during the month from your insurance company. What that means is people with Part D plans who sign up for this plan are now going to have two bills from their insurance company every month. One for the premiums, if they've got one, and usually they do, and then one for the prescriptions themselves. So people need to understand, don't throw away that second letter after you think you already, got the first letter, you took
Oh
care of
my
it. You
gosh,
Yeah,
didn't.
wow.
well, that would never happen. You would never throw away
Not me, not you, but some people might. And the
the
other,
other, the other, but let me mention another wrinkle.
yeah, please.
So you take 7 drugs. A lot of people take a lot of medications. Each of those medications can have their own separate MP3 plan. You don't,
Well, although
people
when
can
I
people can sign up for individual drugs. When you get a new prescription during the year, you can trigger a new MP3 plan.
right,
Um,
but if you're on say five drugs, and you know you're going to be on five medications that are covered by your plan next year, when you sign up through open enrollment for the prescription plan, I've been told you only sign up one time and it's for all of your medications. So you don't have to think about
yes.
filling out this form five times. But I do think it's going to be something of a mess. I do agree with you. It can be very helpful for some people, not for everybody. And I think it is going to be confusing for some people on Medicare and also for their pharmacists.
Yeah.
Um,
Again, I love my pharmacists. I think these people deserve more support. The other issue this all raises, however, knock on wood, someday Congress is going to behave like an adult. Um, and
I don't know.
and one of the things that needs to happen is that the restrictions on Medigap need to be changed. They need to be changed for people who are over 65, but they especially need to be changed for disabled people under 65 who don't have guaranteed access because they never turned 65. For them to get Medigap plans can be a real hassle,
Mm,
and they need the same kind, they need more protection than
yeah, yeah,
otherwise healthy people need, and they're not getting it. And that has, see, Medigap is regulated by the states. Um, State regulation is like the way Washington was constructed to avoid capture by the British. You can't make sense of the Washington street grid. Um, the same thing is true of these state rules. It's very hard to interact with Medigap on a national basis. That's what this policy needs to do. The insurance companies that control at the state level aren't going to give up their power easily. But we need a better way so that when your Medicare Advantage plan starts to act against your interests rather than for it, you have the option of going back to traditional Medicare without having this stressful process of, can I get it? What's it going to cost me? That easy transition is the best way to keep
yeah,
Medicare
that makes
Advantage plans in
sense.
line. The
Yeah.
best regulation for them to do what they're supposed to do.
Before I want to do something as we're coming down to the end, I think the major it's so great to have you here. I know you know all the answers, and it's a learning experience for me too. So I want you to go back over one thing that's always unclear in people's mind. Traditional Medicare expensive, pay for Part B might even be higher than 178 because your earnings were higher. That could be, the IRMA adjustment, plus you have a supplement, plus you have a separate Part D. And this year you must go look at medicare.gov to put your drugs in to see, because everything's changing because of those limitations. Medicare Advantage, but you can see any doctor anytime, just about. Advantage, limited to their physicians, need pre-authorization. your home is in New York and you spend time in Florida, you've got a problem seeing, unless it's an emergency. People want to know, how do Medicare Advantage plans get reimbursed by the government? Why can some of them offer you a 0 monthly premium and even tell you you might get money back? How can they offer you two free dental cleanings or an eye doctor, whatever it is? Could you just explain how plans get reimbursed and how they're getting squeezed now, please, Phil?
We have another half hour, please. But very simply, when these plans were created in their present form about 20 years ago, the government really wanted to tilt towards encouraging people to consider these plans. So they embedded subsidies in the plans that initially they were paying on a per capita basis like 14% more to a Medicare Advantage plan to insure an individual than they were for traditional Medicare. So in the old line, trust me, these subsidies were going to go away over time, but they didn't. Why? Because the plans have really smart people working for them, and they have substantial strength as a lobbying force in Washington.
Sure.
They have maintained those subsidies. So what do the subsidies consist of? Every year, Medicare Advantage plans make a bid to the government for the following year's coverage. And what they say is, it's almost like name that tune. We can provide all our coverage for X dollars. Well, that X turns out to be much less than what they get paid by the government. And in this ironic situation, the bigger the gap between X's and their costs, the more likely they're going to get approved, right? Because the X is a low number, the government likes a low number. But then between X and reality is the process of, well, what does it actually cost us to provide coverage to patient X? Well, it turns out that there's a lot of wiggle room in how much the government will pay an MA plan to insure an individual. It's based on the individual's health. So this is a little aside, but Medicare Advantage plans are really happy to tell you they'll send nurses to your house to make sure you're doing okay. They'll hold your hand. It's a comfort visit. It's all good. Kumbaya. But what those nurses are doing is they're rating you in terms of your health, and they're evaluating ways in which they can legally but misleadingly make you appear sicker than you are. This is called upcoding. These guys are masters at it. They've upcoded out the wazoo. In some cases, the upcoding is not even something that the patient or their doctors are ever aware of. They don't know this. The government does, though, because it's used to increase their subsidy payments. That's the cushion from which they devise all of these so-called benefits. You really just, the taxpayers paying for this. And so consumers don't feel the pain, so they don't argue. They don't know about the taxpayer component.
But the shareholders, but when the cushion narrows, because the cost of care is not, it gets squeezed by what the reimbursement is from the government and the cost of care, then the profits of these public companies get squeezed and the stocks drop. And the Humana is down 50% this year because they've stated.
And that's the recipe for 2025 because the plans are squeezed. So that's why you have to look carefully at whether or not there's sort of narrower benefits. They're pulling back from things. You just have to, I tell people, spend a half an hour, make $500. I mean, you have to take the time to become informed. But the tools are all there, and the first step is, for goodness gracious, get a My Medicare account. That's the basic free account.
That's where you just go online and you can see everything
you can use
right
to track
there.
all your stuff.
Yeah.
It tells you about all your Medicare claims. If you have traditional Medicare, it tells you the specifics. You put your drugs in that tool and they stay there forever. And so they're automatically transported to the plan finder when you want to look at next year's
So you can
impact
compare
of Part D
easily.
plans.
What about working with a Medicare agent or a broker? Do you think that's a good idea or not?
It's a good idea with an asterisk. I like brokers. Brokers know their stuff. They know a lot about Medicare, but they don't work for you. They work for them and the people who pay their bills, which are the insurance companies. They don't represent the entire market. So use a broker, but don't place business with a broker.
Yeah.
Find out what the broker wants you to do. Say, what are your recommendations? Why do you like this stuff? And you're going to say, well, that's really interesting. Let me get back to you.
Yeah.
So
Phil,
isn't it time for consumers to be able to say, let me get back to you?
yeah. I want to give the show back to Richard, and I know we're running out of time, but I just want to ask one more question that I think has a quick answer to it, which is, in your opinion, what do you think about being able to rely on the trained volunteers that, are Medicare counselors? They're always, glad to help and
Yeah.
make life easier and so forth. But, what do you and Terry, Phil, what do you and Terry think about relying on those resources for help?
Well, SHIP. We didn't say a bad word. SHIP. Phil, you better explain.
Yeah, SHIP is a government-funded program manned by volunteers. So I want to say, taking a step back, I love SHIP. I love the fact that people want to volunteer. I ascribe them with the best motives. They tend to be best on bread and butter questions.
Makes
What are
sense.
the overall rules? They
Yeah.
tend not to be so good on tell me about this specific insurance plan. And in a sense, that would be a heavy lift for them. So I think they're really good for the general rules. They should know about when you sign up for Medicare. They should know some of the basic things of what Medicare does and does not cover. And I have interaction with a lot of SHIP people, and short of forcing them all to buy my book, there's really not a lot I can do. But I do think that it's a good I'm glad we have this program.
Okay.
That book should be on everyone's desk that's a SHIP counselor or a Medicare advisor. And I just want to do a ringing endorsement. Get What's Yours from Medicare, just out, the new edition, up to the second, about these new rules about prescription drugs. You can get it on Amazon. Phil Moeller, Moeller, who's been writing about this stuff and is the expert. So I'm going to run the commercial for you because it's going to be sitting on my desk. Thank you for covering everything.
Yeah.
Well, you're welcome. I started writing in Roman numerals. That's
Richard,
just
take
so
us
our
home.
audience knows, SHIP stands for the State Health Insurance Assistance Programs. These are programs that are run through each state. So if you want to get help from a SHIP counselor, you go to your state health department, your state SHIP plan, and call them up or go online and you can talk to them there. They are not allowed to recommend one particular product, one policy, one insurance plan over another. So you're not going to be able to get them to say, you should go with this plan. They won't tell you that, but they will be able to tell you how to make that decision and how to compare plans, that sort
How
of
to
thing.
get your SHIP together.
Exactly.
Also, it's free.
Yeah, absolutely.
It
Right.
doesn't cost you anything.
Right. Well, thank you so much, Phil, for joining us today. I really hope that today's episode is going to help our audience make some smart decisions about Medicare during open enrollment, and I know it will. Thanks again. Bye.
You're welcome. Good to
Thanks,
be with
Phil.
you.
Thanks for all your good work.
Bye-bye.
Friends Talk Money is funded in part by a grant from the Investor Protection Trust. The IPT is a nonprofit organization devoted to investor education. Since 1993, the IPT has worked with the states to provide the independent, objective investor education needed by all Americans to make informed investment decisions. Visit investorprotection.org. We also receive support from the North American Securities Administrators Association, known as NASA. It's the oldest international investor protection organization. NASA's members include state and provincial securities regulators from the U.S., Canada, and Mexico who serve on the front lines of investor protection. Recognizing that education and awareness are powerful tools in the fight against investment fraud, NASA is pleased to sponsor Friends Talk Money. Here are 3 important tips to help you protect your money from fraud. With investing, there are always risks, so be cautious of anybody telling you that a certain investment is guaranteed. You should also proceed with caution if somebody is promising very large investment returns. This is a common red flag for investment fraud. Last and most importantly, be sure you're working with a licensed or registered financial professional. You can check your advisor and make sure they're licensed by visiting brokercheck.finra.org. NASA is your partner in keeping you safe and helping you avoid investment frauds. Visit nasa.org and click on the Investor Education tab to learn more.